Good afternoon, and thank you for joining me today as we talk about the pandemic here in Erie County. Today, we have no new positive cases of COVID-19 in Erie County to report. And that's always, obviously, a good day when we don't have any new cases. Our total number remains then at 87 cumulative positives, with 1,892 negatives and 59 who have recovered. The state numbers are 45,763 with 2,292 deaths. Crawford County has 19 positive cases. McCain is reporting 6 cases, and Warren County has 1 case. Chautauqua County has 33 cases and 3 deaths, and Ashtabula County now has 116 cases and 15 deaths. Please understand that while we are pleased to report that we don't have any new cases today, we should still act as if everyone we come in contact could potentially be a carrier of the virus. The Erie County Department of Health is continuing its contact tracing on all of the cases that we have active currently. And our environmental team is out as they have received 22 new complaints, and they continue to make those field visits. As we continue to look towards potentially reopening certain industries in Erie County, the Department of Labor and Industry has issued some new facts for construction guidance, or FAQs, frequently asked questions. It answers questions such as how to file a complaint, whether new construction projects can start, and are employers required to provide masks or face coverings, and so much more. This guidance and more can be found under our business resources page at eriecountypa.gov. Very, very easy to navigate and very good information. We continue to try to make improvements to our website at eriecountypa.gov. The website was down for a short time this morning, and we apologize for that, but our IT team worked very quickly to get it back up and running. More information is added to our website on a daily basis, and we are continually making those adjustments to really simplify how to locate all the really important resources that are available and that you, the public, need. As we start to look at reopening Erie County, please continue to take the precautions when you leave your home. Maintaining that 6-foot distance from anyone who does not live in your home. Wash your hands with soap and water for 20 seconds when you get home. Anytime that you can wash your hands for 20 seconds, do that. And otherwise, have hand sanitizer that you can use after you've been out. And wear a mask or a face covering anytime that you're near anyone else, again, who does not live in your home. Remember that your mask protects me and my mask protects you. So I want to thank you all again for doing your part, because we cannot do this without you in terms of slowing down and stopping, hopefully, the spread of COVID-19 in Erie County. So on Thursdays, I'm always glad to welcome our health partners with us, and today we have them all with us again. So we will start today. I'm going to change it up a little bit, and we'll start today with the Veterans Administration Hospital and Doreen Summers. Doreen, are you with us?
I am. Good afternoon, Kathy.
Good afternoon.
We continue our new normal here at the Erie VA of seeing veterans through virtual and phone appointments and offering resources such as our social support groups for our senior veterans who are in need of added support and connection throughout this coronavirus pandemic. As you may know, May is Mental Health Awareness Month, so we would like to reiterate to our veterans that our behavioral health clinic is here for them and can provide mental health support in the comfort of their own home by phone or video. The VA is now also offering a COVID Coach mobile app. This app is free and is designed to help veterans build resilience, manage their stress, or increase their well-being during this pandemic. You can locate this app by going to www.ptsd.va.gov for more information. We continue to test our veterans for COVID-19 in a variety of ways, including our drive-through testing by appointment only for veterans that meet the criteria for testing and have an order from their VA provider. On the topic of testing, we would like to remind all of our veterans enrolled at the Erie VA that if you're tested for COVID-19 anywhere in the community, please inform your VA primary care provider. You can do this by calling the medical center or by sending a secure message through My Healthy Vet. Again, as a reminder, any veterans experiencing cold, flu-like symptoms, or COVID-related symptoms, please call 814-868-8661 and press 3 for our Ask a Nurse line. They will provide follow-up instructions on this line. And again, Kathy, I wanted to thank you for continuing to invite us to this weekly panel. We really are doing great things here in Erie. Thank you.
Thank you, Doreen, and thank you. That's a lot of great information today, and thank you for bringing up the mental health of not only our veterans, but really everyone. And we do have resources for people on our website. So if you're struggling with anxiety or any other condition that makes you anxious, please look for those resources. They're out there for you. And now I'd like to ask LECOM Health, Monsignor David Rubino, if you'd like to say a few words.
Good afternoon, Kathy. Thank you again for inviting us, and thank you for the good job you're doing telling the community what's going on relative to COVID-19. Relative to Millcreek and Corey Hospital, we've done about 160 tests. Our ER traffic has been stable and personal protection gear is adequate. We will begin elective procedures on Monday, May 4th, and we'll follow all the guidelines of the American Hospitals Association joint statement for resuming elective surgical procedures. The senior living communities are still restricted to no visitors. All employees and staff are required to wear masks in the facilities, and we have adequate equipment to cover and to care for our own staff and our own residents in those facilities. Telemarketing is busy with our doctors and manufacturers, and they are seeing a higher volume of patients telemarketing rather than office visits. And behavioral health is interesting. Behavioral health has been very busy, in fact, at an abnormally high volume of contacts. It seems that people are truly worried about their life's obligation and worried about how they're functioning in this environment. So Dr. Megan McCarthy, the director of the institution, gives me these few tips to pass on. She reminds us today that we should continue when we're home to try and keep a schedule as best we can. Self-quarantine is not a vacation, so it's important that we keep some structure and learning and physical activity in our children's and in our own daily schedules at home. She says, limit the exposure to the news. And by that, I think she means limit the exposure to the children, because children watching this can become quite frightened as to what they see on the news. And finally, she says to talk to our kids about their feelings and to validate those feelings of our children. We have to acknowledge that this is difficult. Again, there is no such thing as perfect parenting, and no one is perfect. So acknowledge your feelings, validate your feelings. Don't measure yourself against an ideal of perfection, which is non-existent anyways. Just do what you can and be honest with yourself and your kids. And again, thanks for inviting us, Kathy, and that's all from LECOM.
Thank you, Monsignor Rubino. And I think actually the advice to sometimes turn off the news and turn off COVID-19 is good for every one of us. We all need to take a break from this at times and lose ourselves in a book or something else. So thank you for all of that great advice. Allegheny Health Network, St. Vincent Hospital. We have Dr. Wayne Jones with us again today. Dr. Jones.
Well, thank you, Kathy. Thank you for having me back. And Father Rubino, I always love those messages that you put out to us. Very good messages. Here at St. Vincent, we have some sad news to report. In the past 2 weeks, or the past week rather, we've had 2 deaths. And we want to offer our condolences to the families. These deaths were secondary to a COVID infection, which we treated here at St. Vincent. Currently, we have no patients with COVID within our hospital. I tell you this because I want to make sure we're honest and open with all of you and what's going on currently within our community. We need to trust each other. To date, we've tested more than 1,000 patients. We have about just under 4% positive rate of COVID within that test group. We are performing in-house testing, so it's much more timely now. Like LECOM, beginning Monday, our elective surgeries will return, both at the surgery center and at our main operating room. we'll do an intensive screening. So patients before they arrive and on arrival, we'll make sure that they're appropriate for their surgery and appropriate for the environment they'll be in. We'll be maintaining social distancing and all the other requirements for opening. At St. Vincent, it's a culture of safety first, the patient safety and also for caregiver safety. I've talked about this a couple of times, and I want to go back to one point I've talked about before. And this is the healthcare crisis in a healthcare crisis, is what they're coining it now. Of course, the healthcare crisis is COVID, but the crisis within that is that patients aren't seeking healthcare for health-related conditions. And there's a study came out 2 days ago from the American College of Emergency Physicians, and it was republished in Modern Healthcare just yesterday. And they found this: 80% of patients were concerned that if they go to the ER, they may be exposed to COVID. 30% of the patients were not seeking healthcare for current active health conditions for concerns over COVID. 75% were worried that there may be excessive wait times or overcrowding because of the current health condition that's out there. And 60% were concerned they'd be turned away based upon this, both at maybe a primary care office or the emergency department. I want to tell you today, none of this is true. It's safe to seek care in Erie and Erie County. Whether you're going to go to your primary care office, the urgent care, your ER, it's safe to go to the doctor. It's safe to come to St. Vincent. So Kathy, back to you. Thank you.
Thank you, Dr. Jones, and what a very good message for people. We have great hospitals in Erie County, and you should always feel safe going there, and we don't want people to ignore other signs and symptoms that they have because of COVID-19. Please go get the help that you think you might need as quickly as you can so that the doctors and nurses in our community can help you. UPMC Hammett, Emily Shears is with us too.
Hi, thank you. Good afternoon. We're always thankful that we can be a part of this important briefing for the community. On behalf of UPMC Hammett, I would like to thank our community for their willingness to mask and social distance. These efforts have helped us protect our healthcare workers and others in essential services. Last week, as mentioned, Pennsylvania announced that hospitals like UPMC Hammett could resume not just essential care, but also certain preventative and elective care. This includes things like procedures, surgeries, colonoscopies, blood tests, and cancer screenings. We will be opening our surgery center next week to resume needed procedures there. All of this will be done safely and in conjunction with continued testing and careful planning. We want to be able to address the backlog of postponed but medically essential procedures. Our robust testing process throughout UPMC has tested thousands of patients, and we haven't had a single asymptomatic patient in Western Pennsylvania test positive for COVID-19. Any patient who needs preventative and essential care can and will receive it safely from UPMC Hammett, whether that be through a video visit or in person. Additionally, we continue to have stable, manageable number of hospitalized patients positive for COVID-19 throughout the system, utilizing only 2% of the 5,500 available hospital beds in our 40 hospital system. We're preparing our hospital and teams to quickly return to providing expert care to the vast majority of people we serve who do not have the disease, while tending to those who do have COVID-19. We're fully committed to keeping our patients and healthcare workers safe as we resume the full range of our world-class healthcare services. Again, thank you to the community. Please know your support has been very appreciated, and we do look forward to safely serving you.
Thank you, Emily, and those very good statistics just support that it's safe to go to our hospitals and to get the service that you need and the care that you need. So again, just want to reiterate that message and that all beginning their elective surgeries, I know it'll all be done safely and with the great care that you always give all of us. So thank you very much for that. And right before we go to the media, there's just one more thing I want to mention. I've mentioned it once before, I think earlier this week, as the Northwest PA Career Link has a virtual online job fair coming up Monday, May 4th, and that'll be from 8 a.m. to 8 p.m. And you can register for that by going to NWPA Career Link.easyvirtualfair.com, or just type in Northwest PA Career Link, and you'll find that on their webpage. So anyone who's looking for a job, we definitely have businesses out there looking for employees. So I know that many people have lost their jobs, and there are jobs out there. So please think about that virtual job fair. And now I would like to go to the media for questions. And today we're going to start with the Erie Times News.
Hi, Kathy. This is Maddie. Can speak to whether today's number of the positive cases, the fact that there are no new ones, do you think this is an early sign of a downward trend? Do you know if there are any tests in the pipeline that we're waiting to come back right now?
I don't know if there are tests in the pipeline. Again, County Health Department does not do testing, but we've had some other periods where we've had no new cases, and then of course we had a fairly large rise in those cases just in the last week or so. And again, we attributed some of that maybe being to the Passover Easter holiday and people getting together and not social distancing and not wearing their masks and things like that. So as we look at potentially and hopefully moving to the yellow phase in a week from tomorrow, we get concerned about that because we know the virus is still here. So I think we all need to remember that. But obviously, when we can have hospitals saying they have no COVID positive patients there right now, and we have no positive cases to report today, those are all good signs that people in our community are doing all that we need to do and doing the right thing to try to keep our numbers as low as possible. Erie News Now.
Good afternoon. A question for you regarding conversations with the state. I know you said you were hoping to speak with them yesterday. Did those conversations come to fruition? And if so, what can you tell us about what was discussed?
So we did have some conversations yesterday. I have more after this briefing today, and some of my staff has other conversations with others. And so we're just trying to gather more information about, what this is going to look like when we move to the yellow phase. We know we will know for certain tomorrow. And indications are that we will probably be in that group that goes to the yellow phase, but we'll have confirmation for sure tomorrow by the governor. And we need to be ready for that. And we need to be ready for the onslaught of phone calls and the questions that are going to come to us about that. So we were really just trying to understand, maybe a lot of what we were trying to understand was what is going on in the other counties around us that don't have health departments, who haven't been doing the contact tracing, who haven't been doing the enforcement like we have. And what we found out is that the State Department of Health has begun doing that contact tracing in those other counties, and they've been doing it for a little bit over a week, I guess. And so that's good to hear. And then, the enforcement piece and who's going to be doing that. And we want to make sure that it's also equitable. And so we just talked about sort of the processes that we're doing here and maybe some of our specific questions and our specific concerns so that we can continue to gather more information. And we've been told that there is more guidance coming, and we should be having that by tomorrow also to give our businesses.
So after having those conversations then, would you say you're feeling more optimistic, less optimistic, or roughly the same in terms of our odds of reopening a little bit starting on May 8th, and then also in terms of being able to make that feasibly happen if it does come about?
So I think my optimism remains about the same that it has been. Our numbers have been good. We've been doing a very excellent job in Erie County of really mitigating that spread that we had feared and the surge that we thought might happen for our healthcare facilities to have to deal with. And so all of that has been very good. And it's really been a partnership. It's not just been County Health Department and county government, but it's been this partnership that we've had with healthcare providers and just so many others in the community. So I feel optimistic, but there's always that bit of trepidation as we move to this level of yellow, hopefully tomorrow, and we know that there will be more cases. We don't know how many more as people feel freer to go out and about, and especially as some people may not follow the guidelines that we've continued to talk about. Talk Erie?
Yes, good afternoon. It's Joel Natale. I have a question for the healthcare providers. I was wondering if they could report how many Erie and County employees have been laid off in their footprint And do they have any idea when they could be called back?
Would one of you like to take that first?
Yeah, this is Dr. Jones from St. Vincent. I do not have any numbers on that. As far as I know, it's St. Vincent and HN Network. No one has been furloughed or laid off at this point. But that's the best of my knowledge, and I'd have to report back to you for anything better.
This is Doreen Summers. We have not laid off any employees at the Erie VA.
At UPMC Hammett, I do not have specific information, but to the best of my knowledge, we have not had any layoffs.
Specific information on that.
I'm sorry, Monsignor Rubino, we didn't catch you there.
I'm sorry.
Can
I
you-
said relative to LECOM and Corey Hospital, I don't have specific information to share on that.
Okay, thank you all.
Thank you.
Jet TV.
Hi, Kathy. It's Samir. So my question today, right now, is regarding, I guess, businesses to open. I know you don't know specifics, but do we know if places like salons will be opening? Pretty hot topic, haircuts.
The first one was about haircuts?
Yeah. Do you know if salons will
Oh,
open?
salons. I'm sorry. I thought you said lawns. I was trying to, salons.
No.
I'm hearing that they may be doubtful whether those are going to open up. And I'm, of course, with my own hair, would love to have a haircut. It's been a long time, but that would be something I know many of us would be disappointed with. But we also know that that is an industry where you have very, very close contact with each other. And I can see where the state might find that to be one that they don't want to open right away. Okay, Erie Times News?
Kathy, at this point, do you have any other indications of categories of businesses that will or will not be allowed to open if we move into the yellow zone?
So my understanding is that we are looking at this 25-person limit. So I would say that entertainment will not be opening. So whether that would be a movie theater or a casino or something that would have a large number of people coming in, that's my understanding at this point. Those are some of the ones I know that are probably not going to open. I know for sure gyms and spas and those type of places, massage, therapy, and spas, I guess I should say, definitely are on the list that will not be opening. We're going to find out more, and by tomorrow we hopefully will have a very clear list of which businesses can look and have that week to get ready to open, and which ones will not be opening at this particular time. My understanding is that garden centers actually will be able to open on May 8th also. And I know that's been something a lot of people have been asking about because of this time of year, and we all want to get our garden planted. And so my understanding is that garden centers will be able to be open. But all of these businesses that open are going to also have to abide by this 25-person rule and by social distancing and by mandatory masking. So those things are not going to change for any business that does open.
Got it, thanks.
Erie News Now?
Question for you regarding marinas, golf courses, campgrounds, those sort of things that are going to be opening here basically momentarily. How's the county preparing for that? And then your thoughts on that, any sort of trepidation, any hesitation as we start to ease into this?
Well, the one thing is we would have liked a little bit more guidance. So we're trying to help our golf courses, marinas, campgrounds with what they need to do. And we're still trying to get some clarification on those. Lots of questions coming into our health department about those from those businesses. And so we're helping as best we can. So those are the concerns. You know, another big concern is obviously, I think particularly with marinas and campgrounds, is they will attract people coming into Erie County who don't live here. You know, a lot of people from places such as Allegheny County and places to the south have boats at our marinas. And we know that a number of those people from those counties to the south of us also have campers at some of our private campgrounds. And it's only the private campgrounds. We know the state is not opening up any of the public campgrounds. So those will be happening, and we again hope that people will remember that we have all of these guidances in place, compliance with masking and 6-foot distances, and so the social physical distancing. So it's going to be interesting. It's going to be a beautiful weekend, I think, here, and so that should bring a lot of people out to try to get their boats in the water and maybe potentially come up and get their camper opened up for the season. And again, those are the concerns we have, because those counties that would be way south in the southwest and other places would still be under a stay-at-home order, but we're just not sure if people will stay home or whether they'll come up here.
And will you be beefing up enforcement teams at those areas? Will that kind of be the focus here Friday, Saturday, Sunday, trying to send more people to those areas, just trying to keep an eye on things?
Well, we've been sending a lot of surveillance teams out just to sort of see what's going on, and that helps us to give a pulse on what's happening in many of these different areas. And I think we'll have some enforcement teams going out this weekend. And again, we're not out there to try to be punitive. We're out there to try to be helpful and help businesses be compliant. And I know that our businesses, our marinas and campgrounds and golf courses, they want to open up, but they also know that there is a lot of safety issues and they want to be compliant. So we're there to be assistants of them, and we're trying to answer their questions as well as we can. So that's what we'll be doing, and giving guidance whenever we can. And if we see something that's really egregious, we'll go out there and address that. And a lot of the times when we go out, it's really because of a complaint that's called into us from a concerned citizen. Talk Erie?
Yes, another question for somebody from the healthcare field there. We're getting all kinds of information about, at least on a national level, the blueprint for testing, talking about mass testing, millions of tests a week. And then we're also hearing from Secretary Levine at the state level saying, no, we can only test symptomatic patients at this time, although things have been loosened up a little bit. What does massive testing, quote unquote, mean for Erie, Pennsylvania? Can somebody decipher that for us?
Who would like to take that?
Oh, I can speak within UPMC. We are expanding our testing as we're starting to reapproach some of those elective procedures and that necessary medical care. So our capacity is growing every day. And I know everyone across the country and other healthcare systems, as capacity grows, we're right there with it. We have the supplies, we have the labs. And so as we expand that footprint in our area, that will start to include some asymptomatic screening of patients that are going to be getting a high-risk procedure, something that might enter the airway, or if they're having a surgery and we feel that they're in a high-risk category. So I think we will be expanding testing in this area. Does that mean right now everyone in the community is going to get a test that's asymptomatic? I don't believe so, but continuing to kind of expand criteria in terms of services that are applied.
I think Emily's absolutely right. I think everybody's capacity to test has exponentially increased over the last 6 weeks, and we'll just have to play this by ear as we have elective procedures beginning, how much we test. But what massive is, I can't define the word, and it's hard to answer.
And I agree with the other two. We have gone from sending testing to California to sending testing to Pittsburgh, and now testing within our own hospital. And it's going to continue to expand. What you're seeing is much of the testing going to the hotspots, which is New York City, and somewhat to California and Florida, but in Louisiana. But we will probably see more testing here as time goes on, as supply chains loosen up and it's reallocated.
Thank you. Thank you all. Doreen, did you want to add anything?
No, thank you. I agree with what everyone else articulated. Thanks, Kathy.
Sure. Thank you.
Just a quick follow-up, Kathy, if I might. Again, the concern has been about reagents and the supplies. You've even mentioned the swabs being short supply or so on. Has that supply chain been fixed now in Erie County?
Well, the supply chain was never Erie County. The supply chain was nationally. And someone else might be able to speak to this better, but my understanding is the supply chain has improved, as it has for a lot of things that we need, PPEs and et cetera. Is it perfect, and is it to the way we all would really want it to be? I don't believe it's quite there yet, but I do know that there has been a definite improvement in the supply chain. And if anyone from the health systems would like to speak to that, you may have much more knowledge about that than I do.
No, Kathy, that's the perfect answer.
Okay, thank you.
I agree with Wayne.
Thank you. All right, Jet TV?
Yeah, hi, Kathy. It's Samir. I'm going to ask this one to our medical providers. So looking at the data you guys have during this COVID-19 pandemic, do you feel Erie is ready to move into the yellow phase? Do you feel like that's a safe bet right now?
This is Doc Jones from St. Vincent. We are ready. I think we've done a lot of mitigation over the last several weeks. I think we've really bent the curve, if you want to call it that. But we've also had time to prepare. And I think as a facility, I think as a city, as a county, this is the best prepared we can be for this disease.
And from UPMC's perspective, I would definitely agree with that. I think that we have taken the appropriate steps. We've been thoughtful and careful about our approaches, making sure we have all the safety measures in place, making sure we have supply chain in place. So absolutely, I think even if we had a small surge based on community getting back to normal activities, I think we're more than prepared to care for those patients. But we do, want to encourage everyone as we move forward to stay diligent with the masking and the social distancing, and that will keep us in a good situation.
Father Rubino, from LECOM's perspective, I agree with Wayne and Emily, absolutely. But one has to ask, why are we prepared to take the next step into yellow? And I think there's been a tremendous amount of collaboration and cooperation among everybody in the community. That's enabled us early on when we ran out of face shields. Gannon was producing some, and then there was another manufacturer outside the city. There was a mask issue early on. People jumped in to do that. So I think the collaboration and cooperation across the professional agencies and individuals in the city has enabled us to take this next step, and I think we should take it.
This is Doreen. That's exactly what I was going to say as well. Because of the strong community collaboration, I really feel that we have been and will continue to be prepared to move forward and care for any patients that need to be cared for.
I will say too, at the state, one of the conversations we had was that they do look at Erie County and our region as being a true example of how things have really gone right around this pandemic in the Commonwealth. And I have to really thank, and I'm very, very grateful to our hospital systems who have collectively been meeting. And that doesn't always happen because we know there's competition out there, and they have been collectively meeting on a regular basis to discuss all of these issues around this pandemic. And that's really, I think, been huge for our community. And so I want to thank all of you who are with me today and your systems for really having that collaborative effort and cooperation together.
Great, and just one more question, Kathy. Could you clarify, the math, especially required with retail outlets and convenience stores? Who is charged with enforcing that? Do they have to? I've received a couple calls and emails about that, and community members still seem to be a little confused on that one.
So it really is up to the business to enforce it. And the businesses that are doing the best are the ones who have that sign at the front that says masks required, or no mask, no service, or however they want to word it, and to have that very prominently. And then when people come in, if they don't have a mask, tell them they cannot be served, or they need to walk outside. And you will find a way to bring whatever they need out to them, or maybe you even have the opportunity to provide them a mask. Not every business has that ability, I understand that. So it really is up to the business to be enforcing the mask guidance, the universal masking that we are asking everyone to follow. And again, that mask doesn't have to be fancy. It can be a gaiter that you wear around your neck and you just pull up over your nose and your mouth. But it is up to the business to make sure that people not only are wearing a mask, but they should also be asking people to wear them correctly. Because we've seen a lot of people out there wearing masks maybe just down around their mouth or kind of hanging loosely as they talk. And we needed to cover both the nose and the mouth completely. Erie Times News, do you have any final questions?
Yes, Kathy, I had one quick cleanup question from yesterday, and then I have one for the healthcare providers. From yesterday, Kathy, we noticed after the fact that there were no numbers provided on the Hispanic population for Erie County in the demographic information, and I was just wondering if that was an accidental omission or what happened there.
You know, I'm not really sure, but I'm either assuming there is no one that fits that profile, or it could be in those numbers that are unknown from some of the testing that came through that didn't have the demographic information along with it. But I'll try to clarify that for tomorrow's briefing.
Thank you. And then for the healthcare providers, two quick questions. I know that St. Vincent said they have no COVID-19 patients right now. Do any of the other hospitals have COVID-19 patients at the moment? And I also wanted to check with Doreen, is the VA moving to elective procedures, or is it remaining with essential or emergency procedures only?
Doreen, would you like to go first?
Sure, thanks. We are currently in the planning process for doing exactly what the other facilities are talking about. But to answer your question, right now we are continuing with only emergent cases.
Thank you.
And either LECOM or UPMC Hammett, would you like to talk about if you have any active cases or not?
We don't comment on the diagnosis of our patients, but we are providing safe care to everyone here.
Thank you. And LECOM?
This is LECOM by policy. We do not comment on the status of patients, but we provide safe care according to all the appropriate regulations we're required to follow.
Okay. Thank you. Erie News Now, do you have any final questions?
A final one for you, if I may. A question about learning perhaps tomorrow whether or not we'll move into that yellow phase and a clearer picture of what businesses will reopen. We've had a handful of businesses reach out to us here still, playing this waiting game. Do you worry at all that the lack of communication from the state up until this point sets business owners up for heartbreak, where they think there's a chance that they'll reopen only to find out 2 weeks later that it likely isn't going to be the case?
I completely agree with you. We wish we had all that information to give businesses. We wish we had it a week ago. We wish we knew, there's so many things we wish we had communication on and had, as people have said, a crystal ball to answer those questions. But we are working diligently to try to get the information as it comes available to us. And I've been here telling you anything that we know. And if we don't know it, then I just have to wait until we get the confirmation from the state, who is really overseeing the closures of business and the reopening of business. So yes, it's going to be very difficult for some businesses who might think they are reopening and don't get the go-ahead tomorrow. Talk Erie?
Just a quick clarification question for you, Kathy. Getting some questions about when we go to yellow, childcare, daycare centers are reopening. Is there masking guidance that you can clarify for the little ones? Are little children going to be required masks inside daycare? Some of the daycare workers, some of the parents are concerned that the other kids may have symptoms.
Sure. That is a concern. I know. I don't have the guidance for the daycare centers. We have not received that. I'm hoping, and that's one of my questions today, that the guidance will obviously be sent directly to each daycare center, who then would communicate with their parents. And obviously, if we can have that guidance too, we would put it up on our website so that everyone could see that. Children's masks obviously have to be smaller. It makes it sometimes more difficult, little kids, to keep a mask on their face. So I'm not sure what that guidance will be. I know the guidance for going into a store is that children under 2 don't need to have anything on their face. So the littlest ones don't need to be wearing a mask when they go. But with stores, we're hoping that parents actually don't take their children to stores. Just go in by yourself. But with daycare, it's obviously a different situation.
Thank you.
Mm-hmm. And Jet TV, do you have any final questions?
Just one last one. I guess taking a look at Wabtec's announcement yesterday to lay off nearly 300 employees coming up in the next couple of weeks, I guess, is there a fear when looking at how like Pennsylvania's economy, the overall economy, is going to be impacted with this COVID-19 pandemic as it still continues?
I think this pandemic is going to affect our economy in terrible ways. It already has, and I think we're going to see the effects of this on our economy for a very long time. None of us know exactly how deep and how difficult it is going to be to come back, but I do know that we're a resilient people, and we have a lot of good things in place that we actually didn't have in place 4, 5, 6 years ago in terms of how this community can come forward. And I know the Chamber is really working hard with their Restart initiative and working with all of the entities in economic development, and they will be out there working diligently with each one of our businesses to try to help them through this. But there will be, unfortunately, businesses that do not survive. There will be businesses that unfortunately will end up having less employees and a different maybe model as they go forward. And then on the other hand, we have some businesses that are actually busier than ever, and they have more work to do. And that's why that job fair is important for people to look at that, because there are jobs out there. But yes, this is a devastating blow to the economy of the United States and actually to the economy of the globe, and you just have to look at the markets to know about that. So Erie is not immune to that. We did not get by without that same effect here. But we hope that we can get out of this faster than maybe some other communities because of the hard work has been done here over the past number of years to really try to build, our renaissance, our new economy, and we're going to have to take a step back, but we can hopefully leap forward quicker than we would have if we didn't have those things in place.
Perfect. Thanks.
So I want to again thank our healthcare providers for being with us today. It's really great to hear from you, and I think it's really important for the community to hear what is going on in each one of your facilities. So thank you again for caring for the people of Erie County in such a compassionate and skilled way, and we really are grateful for all you do. And lastly, this is the last day of County Government Month. I talked about it earlier in the month. And we often struggle with people understanding what county government does, but we don't think that happened this month. We think you have a very good understanding of at least a portion of what county government does. And I want to give a final, just huge thank you to the county workers from all departments, not just the health department and public safety, but all of the county workers who do their work every day to serve the people of Erie County. You are my heroes, and for that, I am very, very grateful. And with that, I ask you all to please try to stay home, please stay safe, and please stay calm.